Hi, you guys. Welcome back for our daily practice questions. It is day 107. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 73-year-old woman presents for routine bone density screening. She has no history of fractures or steroid use. Her DEXA scan reveals a T score of negative 2.6. What is the most appropriate diagnosis based on this T score? Is it A, normal bone density, B, osteopenia, C, osteoporosis, or D, severe osteoporosis? Take a moment and tell me what you got in the comments, y'all. All right, you guys, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the most appropriate diagnosis based on this T score? All right, so this stem of the question tells us everything we're looking for, right? So, we're trying to determine how to diagnose something from a particular T score. So, the T score is negative 2.6, right? So, what does that mean when we are considering a diagnosis? So anything that is negative 2.5 and lower, so anything less than negative 2.5 is C, osteoporosis. Okay, so C is your best answer. Question number two. A 60-year-old woman with no significant past medical history undergoes a DEXA scan. Her T score is negative 1.9. Based on these results, how would you classify her bone health? Is it A, normal, B, osteopenia, C, osteoporosis, or D, you cannot determine? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, based on this result, how would you classify her bone health? So again, we need to look back at this T-score because that's what's going to help determine the bone health from this DEXA scan, right? So the T-score is a negative 1.9. So and you're going to have to know this chart and understand the DEXA scan and T-scores to get these correct each time. But if it's anywhere from negative 1 to negative 2.5, that is B, osteopenia. Okay? So remember, osteoporosis is negative 2.5 or lower. So the number is going to go higher because they're negatives, right? And anywhere from negative 1 to negative 2.5 is osteopenia. Because, osteopenia is like that pre stage. That's where you're starting to notice low bone density. But when you get to osteoporosis, that's where they have more porous bones and the density is worsened and they're more inclined to fractures. Anywhere from negative 1 and greater, so into those positive numbers, is a normal finding of bone density, okay? And then question number three, a 65-year-old man is diagnosed with osteoporosis after a DEXA scan shows a T-score of negative 2.7. He has no history of fragility fractures, and you decide to initiate treatment. Which of the following is an appropriate first-line pharmacologic therapy for this patient? Is it A, acetaminophen? Is it B, Evista? Is it C, ibuprofen? Or is it D, alendronate? Take a moment and tell me what you got. All right, so stem of the question, which of the following is an appropriate first-line pharmacologic therapy for this patient? So it's just asking you, what is the treatment and what do we do with treatment style questions? We run it back and look to see if they provided us with a diagnosis, right? And in the event that they have not, we run it back a step further and look at those assessment findings so that we're able to gauge what the diagnosis is, because we got to know what it is to be able to treat it. Here it tells us that the patient has been diagnosed with osteoporosis. That T score of negative 2.7 confirms that diagnosis, right? So, what we're going to do is consider those first line therapies for osteoporosis. And remember, your first line therapy for osteoporosis are your bisphosphonates, being D, alendronate, aka Fosamax, okay? I always say that word weird, but it's Fosamax, right? So your bisphosphonates are your first line therapy for osteoporosis. B, Evista is also used for osteoporosis, but it's not first line therapy. Again, remember, bisphosphonates are your first line therapy, okay? And remember, when someone is taking a bisphosphonate, you're prescribing it. Think what your provider had, right? You're going to tell them you want them to take it on an empty stomach. They need to drink a full glass of water, and you do not want them to lie flat for 30 minutes after taking it. So oftentimes we'll tell someone to take it first thing in the morning and go take a walk. So that it keeps them occupied so they're not forgetful or inclined to lie back, because this can cause esophageal erosion, okay? So we're really big on making sure that we emphasize and advise and instruct them appropriately with this medication, okay? But all right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure that you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.